Is it just a speech delay, or could it be something more? Early communication struggles can be confusing and overwhelming for families, but understanding the difference between a simple delay and the early signs of autism can change a child's entire future. Let us talk about the key signs you need to know and how early support makes a world of difference. Early communication matters. In today's video, we break down the key differences between speech delay and autism, and why recognizing the signs early can make all the difference. Whether you're a parent, caregiver, educator, or advocate, this guide will empower you with clarity, compassion, and next steps. Let's dive in and support every child's unique journey. Speech delay versus autism. How to tell the difference early. When a child is not speaking as expected, it naturally raises concerns for parents and caregivers. Speech delays can stem from many causes, some mild, some requiring specialized support. Among the more serious considerations is autism spectrum disorder, ASD, a developmental condition that impacts communication, behavior, and social interaction. Understanding the differences between a simple speech delay and signs of autism is crucial for early intervention. In this guide, we'll explore what distinguishes speech delays from autism-related communication challenges, how to identify early signs, and why early recognition and support matter. What is a speech delay? A speech delay occurs when a child is developing speech and language skills in the typical sequence, but at a slower rate than expected. They may understand language better than they can express it, or may struggle with articulation. Common signs of speech delay: limited vocabulary for their age, difficulty putting words together into sentences, challenges with pronouncing certain sounds, frustration due to inability to communicate, good nonverbal communication, strong social skills despite limited speech. Speech delays may result from hearing problems, developmental language disorders, or environmental factors such as limited exposure to language. Importantly, children with speech delays often show typical interest in social interactions, making eye contact, smiling, and seeking comfort. What is autism spectrum disorder? Autism spectrum disorder is a neurodevelopmental condition characterized by differences in communication, social interaction, and behavior. Children with autism may also experience speech delay, but communication challenges are usually more complex and are accompanied by other symptoms. Common signs of autism: limited or absent eye contact, reduced interest in social interaction or peers, repetitive behaviors, hand flapping, spinning objects, intense focus on specific interests or objects, difficulty understanding nonverbal cues, facial expressions, gestures, sensory sensitivities to lights, sounds, textures. While delayed speech can be a feature of autism, the broader patterns of behavior and social engagement distinguish autism from a simple speech delay. Key differences between speech delay and autism. 1. Social connection. Speech delay. The child is socially connected. They enjoy cuddling, smiling, playing peekaboo, and showing others their toys. Autism. The child may prefer to be alone, show little interest in interactive games, and may not point to show interest in objects. 2. Nonverbal communication. Speech delay. Gestures like pointing, waving, and nodding are strong. Autism. Gestures may be missing or used in unusual ways. For instance, leading a parent by the hand without making eye contact. 3. Interest in social imitation. Speech delay imitates others' actions, words, and behaviors. Autism. Limited or no imitation, less interest in copying what others do. 4. Play skills. Speech delay engages in imaginative play, pretending a block is a car. Autism may focus repetitively on parts of toys, spinning wheels, rather than using them functionally. 5. Reaction to environment. Speech delay typically responds to their name and changes in the environment. Autism may not respond when their name is called, and might seem unaware of the environment or overly focused on specific sensory experiences. Why differentiation matters. Early identification of autism or other developmental challenges allows children to receive interventions that can significantly improve outcome. Children with speech delays benefit greatly from speech therapy, while children with autism often require a combination of therapies addressing communication, behavior, and social skills. If a child only has a speech delay, therapy can rapidly boost their language skills. But if underlying autism goes unnoticed, the child might miss critical support during a window when the brain is most adaptable, usually in the first 5 years of life. The role of screening tools and evaluations typically screen children for developmental milestones during regular checkups, often using tools like the Modified Checklist for Autism in Toddlers. Ages and stages, questionnaire, ASQ, speech and language evaluations. If a delay or concern is noted, they may refer families to developmental pediatricians, neurologists, or psychologists for further assessment. When to seek a professional evaluation. If you notice any of the following, it's a good idea to consult a professional. Lack of babbling by 12 months, no words by 16 months, no two-word combinations by 24 months, limited eye contact or social responsiveness, repetitive movements or behaviors, lack of interest in interactive play. It is important to remember, getting an evaluation does not mean something is wrong with your child. It's a way to get clarity and empower families with the right support and tools. How parents and caregivers can support development regardless of whether a child has a speech delay, autism, or both. Early engagement with supportive strategies is beneficial. Strategies include talking and narrating. Speak about what you're doing during everyday activities, interactive play games that involve taking turns, pretend play, and exploration. Reading together. Reading builds vocabulary, attention, and listening skills. Using gestures. Combine gestures with words to strengthen communication. Speech therapy. A speech-language pathologist can create tailored strategies. Early intervention services. Government programs like Early Intervention or Birth to Through offer therapies for children under 3 years old. Final thoughts. Empowerment through understanding. Every child's developmental journey is unique. Some children simply need a little extra time to find their voice. Others may face more complex challenges that require tailored interventions. The goal is not to label or limit a child. It is to empower them to reach their full potential by meeting their individual needs as early as possible. Parents, caregivers, educators, and healthcare professionals are all vital partners in this journey. By learning the early differences between speech delay and autism, we can open doors to understanding, acceptance, and success. If you're concerned about a child's development, trust your instincts, seek guidance, and know that early support makes a lasting difference.